In more local coverage now, Rhode Island lawmakers are trying to work on a series of bills that could possibly bring some new regulations for nursing homes. And new at noon, we're hearing from an advocacy group that says that the proposals could potentially make things worse. Reporter Brandon Truitt joining us in our control room. And Brandon, a news conference just wrapped up on all of this.
Yeah, Danielle, just about a couple of minutes ago, in fact, and it was virtual, of course. The state has roughly 75% of the confirmed deaths due to coronavirus stem from nursing homes. So the group Raise the Bar is pushing for these changes, and lawmakers who are supporting these reforms say these bills could be a solution.
Seniors here in the state of Rhode Island really are our state treasures. Not only do we love them, but they help build this country, they help build this state, and they're really a link to our past. They deserve better, and certainly the caregivers deserve better.
And that was the Senate Majority Whip Mary Ellen Goodwin. She's just one of the lawmakers backing the Nursing Home Staffing and Quality Care Act. She calls it her top legislative priority. Supporters of this bill argue that low staffing rates contribute to a higher number of fatal COVID cases in nursing homes, and they want to create a minimum staffing standard. So these bills would set a mandate of 4.1 hours per patient per day. And just before we came on the air, multiple healthcare advocacy groups were reaching out to me against this idea. One of them saying that one of them is the Rhode Island Healthcare Association. That group argues that the suggested mandate of 4.1 hours is higher than any other state in the country. Scott Frazier is the president of that association. He says that mandatory staffing is, quote, an unfunded mandate, making Rhode Island an outlier in the nursing home industry. If passed, these bills will decimate the homes our elderly rely on for care and result in jobs loss across the industry in Rhode Island. And Frazier goes on to say that these proposed bills are nothing more than additional unfunded mandates. He says increasing these hours will ultimately spread the staff thin and puts additional financial strain on these centers. We are continuing to work on this story, getting more reaction on both sides of this. We'll have that for you tonight, starting live at 5. Brandon Truitt, Eyewitness News.